This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman.
And I'm Juan Gonzalez. Welcome to all of our listeners and viewers around the country and around the world. The World Health Organization said Saturday nearly 5,000 people have now died from Ebola out of 10,000 known cases. But health officials say the actual death toll may be significantly higher in Guinea, Liberia, and Sierra Leone. But the three worst-hit countries. The virus is now threatening Ivory Coast, which shares a border with Guinea and Liberia. The World Health Organization has sent experts to Ivory Coast and Mali to help prepare for a possible outbreak. On Friday, a 2-year-old toddler in Mali died after contracting the virus in Guinea. Meanwhile, here in the United States, hospital officials say the first Ebola patient in New York, Dr. Craig Spencer, is in serious but stable condition at Bellevue Hospital. Spencer recently returned from treating Ebola patients in Guinea with Doctors Without Borders. As part of his treatment, Spencer received a plasma transfusion from Nancy Wrightbull, an aid worker who contracted the deadly disease in Africa and survived.
On Friday, the states of New York and New Jersey announced they'd automatically quarantine medical workers returning from Ebola-hit West African countries. A nurse named Casey Hickox, who recently returned from Sierra Leone, became the first health worker isolated under the rules. She arrived at Newark Airport. She was placed in 21-day quarantine in a tent outside University Hospital in Newark. She's threatened to fight her quarantine in court, arguing the order violates her constitutional rights. During a phone interview on CNN, Hickox disputed New Jersey Governor Chris Christie's assertion that she's obviously ill.
I heard from my mother last night, who called me concerned and said, Governor Christie just said in an interview that you were, quote unquote, obviously ill. And this is so frustrating to me. First of all, I don't think he's a doctor. And secondly, he's never laid eyes on me. And thirdly, I have been asymptomatic since I've been here. I feel physically completely strong and emotionally completely exhausted. But for him to say I'm obviously ill, which is even a strange statement. What does that mean? Someone define that for me, because I think I don't quite understand what obviously ill means. But I am here to tell you that I am completely fine physically, and being held here is just, I just don't understand.
That was Nurse Casey Hickox being interviewed on CNN. Public health officials and the White House have criticized the plan by New Jersey and New York to quarantine health workers, saying it could impede the Ebola fight. On Sunday, New York Governor Andrew Cuomo appeared to soften his stance and said people quarantined in the state who do not show symptoms of the disease would be allowed to remain at home.
To talk more about Ebola, we're going to be joined by a number of guests. We start with Carissa Guild, a nurse with Doctors Without Borders, also known as MSF. It's the letters for the French Médecins Sans Frontières. She just returned from Guinea last week, where she was helping to respond to the Ebola crisis. In 2012, she worked with Doctors Without Borders in the Congo to address an Ebola outbreak there. Welcome to Democracy Now!, Carissa Guild. First, can you, before we talk to you about your return from Guinea, if you can talk about the treatment of your fellow nurse, talk about what the whole issue of how Casey Hickox is being dealt with right now. She arrives at Newark and is taken from there, ultimately against her will, placed in 21-day quarantine. She now says she's going to sue over her treatment.
I mean, I think that it was a decision that was made that was probably not well thought out. Like everyone has been saying, there's a lot of, it was just, it's not a well thought out. There's no evidence that she's a risk to anybody in the whole country. So I obviously don't agree with putting her in quarantine. I think that just monitoring your health like we're told to do every day and taking your temperature every day, we can't give anybody Ebola if you don't have symptoms. She obviously doesn't have symptoms. So it was not a very well thought out or rational decision to do, and we'll see what happens.
And Carissa, could you talk to us about what happened to you when you came in the country, when you returned in your last trip from West Africa?
I mean, I just returned back last week, and I came in and I was I went to JFK, and they brought me into a room and they monitored my temperature, and I didn't have a temperature, so basically I just went home. And I follow the daily rules of Doctors Without Borders, where I do take my temperature every morning, and I send an email every morning to the Department of Health, and I let them know that I'm feeling fine, and so far I'm feeling fine. So I think that actually this is less of a problem, and what we're talking about expats returning and not treating them well in the United States and expats having Ebola here in the United States is not really the issue. I think the issue is much more talking about those 10,000 people who have contracted the virus over in West Africa.
Can you talk about what you found in Guinea? Talk about your time there.
I mean, there's a lot of problems in Guinea right now. I've been there, I guess the first time I went was in April, and I basically just have seen the progression get worse and worse and worse with the virus. MSF is basically reaching its capacity. Where I was in a town called Gekadu, which is where the whole outbreak began. And we ended up having nearly 100 beds in our facility. Right before I was leaving, we were discussing of what we do if we have to start turning patients away, because we were getting patients coming from very long distances away. And we were worried that we weren't going to have enough capacity to actually treat and isolate the cases. So there needs to be a lot more work and a lot more help going there to help get this under control.
And what do you think will be the impact of what's happened to Casey Hickox on the other caregivers thinking about going to West Africa and doing their part to be able to stem the spread of Ebola?
Well, I'm hoping that not every state takes this decision, and hopefully the decision gets re-looked at, so hopefully it won't have too much of an impact. I know it wouldn't probably impact me so much going, but that's also knowing that there's plenty of other countries in the world which would be happy to have me for 21 days after I came back and would let me hang out at home and not be in a hospital. So hopefully the decision will get looked at and it won't have an impact, because it would be really unfortunate. It's unfortunate for her. She went over to Africa to help in West Africa for this Ebola crisis. There's a lot of suffering over there. There's a lot of people who are really, really scared over there. And to have her welcome back into her home, like we're welcoming her back, is not the best face of America.
How did you protect yourself? How did people in Guinea protect themselves, both in communities where people had Ebola and in the hospital where you worked?
We were using the personal protective equipment. So when we were in the center, the treatment center, we were very, very well protected. We had the jumpsuit, the yellow jumpsuit on, and masks, and 2 pairs of gloves, and hoods, and aprons, and everything that you see on TV. So we were very protected while we were inside the treatment center. Outside, the treatment center, though, is basically the passive part of a response to Ebola. And the part that's very important is the training of people in the community and doing outreach and going into the villages and speaking with a lot of people and teaching health workers. And this, we were protecting ourselves basically by keeping distance with patients or keeping distance with the population, keeping a 2-meter distance, washing your hands a lot. There was chlorine everywhere. I mean, that said, it doesn't make the risk zero, and there's plenty of health workers in Guinea who've gotten sick. But there's many precautions that certainly MSF is taking, which is keeping me, I feel pretty confident that I don't have Ebola and that I didn't get Ebola while I was there.
I wanted to go back to Casey Hickox, the Doctors Without Borders nurse who was placed in a 21-day quarantine in New Jersey after she returned from Sierra Leone. On Sunday, she called into CNN. This is part of her conversation.
We have to be very careful about letting politicians make medical and public health decisions. And all of the evidence about Ebola shows that if you are not symptomatic, you are not infectious. It's really inhumane. I just came back from one of the most difficult months of my life, and I am completely asymptomatic, and no one knows, no one can predict if I will develop Ebola or not in the next 21 days, and most aid workers come back will not develop Ebola. So to quarantine everyone in case, when you cannot predict who may develop Ebola or not, and to make me stay for 21 days, to not be with my family, to put me through this emotional and physical stress is completely unacceptable.
That was Casey Hickox talking to CNN. What about this issue of the politicians making decisions that really should be in the hands of medical experts and scientists?
I mean, I guess I really don't have too much to say about that. I definitely agree that Ebola is a medical problem. It's an outbreak, and it should be in the hands of people who know what they're doing and who understand how the virus works and how to protect yourself. It's a pretty tricky virus, and there are very specific things that we already know work. And there are people who know those things, and I would trust those people over someone making a decision who is less informed.
Carissa, what is most needed now in Guinea, where you were? What were people most calling for to deal with the Ebola crisis?
I mean, in Guinea, there's a lot of fear, and I've seen it spread quite far. So it started off in one prefecture called Gekedu, and when I was leaving, we were having cases coming from very far away in the whole right half of the country, which means that people were waiting until the end. They were being sure that these people had Ebola. They were putting them in ambulances for 10 hours. They were sending them to our center for treatment. They were arriving very late, so sometimes you would open up the ambulance door and there would be 3 people who were still alive and 1 or 2 people who had died on the way. So I think there needs to be a lot of effort in building treatment centers and making access to care bigger, and doing outreach and training staff workers and training health workers and how to detect cases of Ebola, putting labs to make sure that we know where Ebola is. And there's a lot to be done there right now.
Carissa Guild, I want to thank you for being with us, a nurse with Doctors Without Borders, also known as MSF. She just returned from Guinea in Africa, where she was working with Ebola patients. She's come back to this country and is in Cape Cod now. When we come back, we will go to Jeffrey Sachs, leading economist director of the Earth Institute at Columbia University, has a team in Guinea as well. And we'll speak with Johns Hopkins scientist Nancy Cass about experimental drugs dealing with Ebola. Who should get them? Who doesn't get them? Stay with us.